Hello viewers, I am Dr. Rahul Reddy from Androcare Andrology Institute, Hyderabad. In this video, we will discuss about seminal infections or infections in the sperm. Because most of the patients, they are worried about the moment they see some infection in their semen analysis report, they are worried. And they are worried if you see some websites, they directly, the moment you Google about seminal infections, they show diagnosis as cancer, prostate cancer. This is not the case. These seminal infections are not harmful for your body. What happens is only this can affect your sperm quality or sperm count, and rarely this can cause pain in the testis and pain in the prostate. So now, why these infections come and from where these infections come? This is what you want to know. So now there are three ways that these infections enter into your seminal tract. One, external source. External source means this is related to hygiene or sexually transmitted diseases. So now what happens? Now all the males generally they have to retract the external foreskin daily when they take bath, and they have to clean it regularly. So now if they don't clean it, all this pegma which is formed below the foreskin, slowly bacteria starts growing on that, and this bacteria enters the urine tube and it goes into the seminal tract and cause infection. Same way, if you have unprotected intercourse with a female who is having infections, these infections can be viral, bacterial or fungal, then infection goes through the urine tube and enters the seminal tube. And second way you get these infections is from the urine tract. That means if you have any urinary tract infection, bacteria from this urine tract can enter in the semen tract. And third way of getting these infections is through the motion pipe. Because if you see the anatomy, motion pipe and we call it as rectum, and the semen reservoir which is called seminal vesicle, both are close to each other. So whenever there is some problem in the motion pipe, then slowly these normal bacteria which are in the bowel, because now normally stools will have normal bacteria. These bacteria, as long as they are in the motion pipe, they are harmless, but when they enter the semen system, then they are dangerous. So now why this bacteria enters is any disturbance in the rectum. So problems like hemorrhoids, we call it as piles, fissures, anal fissures, anal fistula, constipation. Even simple constipation can cause these infections, and irritable bowel syndrome. All these bowel related problems can send bacteria from rectum to the seminal vesicle, from where it reaches the semen tract. So these infections have to be identified, root cause has to be identified, and start treatment from the root cause. So if it is bowel related problem, if it is constipation, then you have to treat the constipation first, then treat the seminal infection. Otherwise what happens, every time you give an antibiotic, new bacteria will come in. So you have to treat the root cause. So consult a good andrologist, they will do semen culture, they will do a scrotal Doppler, if necessary they will do a prostate scan or transrectal ultrasound, so that they can understand from where this bacteria is coming, and then treat the root cause. Okay viewers, if you have any other doubts regarding this, please subscribe to our channel and post it in comment section. Thanks for viewing. Goodbye.